Unit 16 Musculoskeletal System 51. A client with diabetes mellitus has had a right below the knee amputation. The nurse would specifically assess for which of the following signs and symptoms due to the history of diabetes. 1. Edema of the stump. 2. Hemorrhage. 3. Separation of wound edges. 4. Slight redness of incision. The correct answer is 3. Separation of wound edges. 52. A client is admitted to the nursing unit after below the knee amputation following crush injury to the foot, lower leg. The clients tell the nurse, I think I am going crazy. I can feel my left foot itching. The nurse interprets that the client attempts to be 1. A normal response and indicates the presence of phantom limb sensation. 2. A normal response and indicates the presence of phantom limb pain. 3. An abnormal response and indicates that the client needs more psychological support. 4. An abnormal response and indicates that the client is about the limb loss. The correct answer is 1. A normal response and indicates the presence of phantom limb sensation. 53. A nurse is planning to teach the client below the knee amputation about care prevent skin breakdown. Which of the following points would the nurse include while developing their teaching plan? 1. A stump soak must be warm at all time and changed twice a week. 2. A residual limb is washed gently and tried every other day. 3. The socket of prosthesis is washed with an Hers bactericidal agent daily. 4. The socket of the prosthesis must be dried carefully before using it. The correct answer is the socket of the prosthesis must be dried carefully before using it. 54. A nurse is caring for a client who had an above the knee amputation 2 days ago. The residual limb was wrapped with an elastic compression bandage. Which of the nurse immediately? 1. Call the physician. 2. Rewrap the stump with an elastic compression bandage. 3. Applies ice on the site. 4. Applies a dry sterile dressing, elevates it on one pillow. The correct answer is 2. Rewrap the stump with an elastic compression bandage. 55. A client just undergone spinal infusion after experiencing herniated lumbar disc. The nurse would to avoid which of the following to maintain client safety after this procedure? 1. Log rolling technique for repositioning. 2. Pillows under the length of the legs. 3. Head of the bed flat. 4. Overhead traps. The correct answer is overhead traps. 57. A nurse has taught a client with herniated lumbar disc about proper body mechanics and other items pertinent to low back care. The nurse evaluates that the client needs further instruction if the client says he or she should. 1. Get out of bed by sitting straight and swing the legs over the side of the bed. 2. Increase fiber and fluid in the diet. 3. Strengthen the back muscle by swimming or walking. 4. Bend the knees to pick up on objects. The correct answer is 1. Get out of bed by sitting straight and swing legs over the side of the bed. 58. A nurse is caring for a client who has had spinal infusion with insertion of hardware. The nurse would be especially concerned of which of the following assessment finding? 1. Complaints of discomfort during repositioning. 2. Temperature of 101 degree Fahrenheit orally. 3. Old bloody drainage outlined on the surgical dressing. 4. Discomfort during coughing and deep breathing exercise. The correct answer is 2. Temperature 101 degree Fahrenheit orally.